The wife of the Bishop of Ajay Crowther Diocese and immediate past Vice Chancellor of Christland University Abeokuta, Professor Mrs. Chinedum Peace Babalola, has said that it is gladdening to know that faith organization covers a commendable percentage of healthcare provision, adding that though a lot has been done, a lot more still needs to be done.
Summit has really highlighted a lot of our gaps, our strengths, our opportunities. I would call it a SWOT analysis. So it's gladdening to note that faith-based organizations actually cover up to 30 to 40% of healthcare provision in the country, and Anglican Communion is part of it. So there is still more to do despite the activities that are going on. And one of them is now a concerted effort. We want to appreciate the primates for supporting what is going on, and this is Summit 2. So concerted effort to pull out what are our resources, human resources, capital resources, whatever resources we need to provide help. Let's now collate them. What's the manpower that we have? So we need a desk or program officer in the Church of Nigeria here that will collate and build up our database. Let's know where we are and where we are going. And then when we build up that database, we have also said that every diocese should ensure that they have a facility, a health facility. And other smaller places should have either clinics or health posts. So every parish, no matter how poor, should at least have a first aid. And then of course training and retraining of both healthcare providers and non-skilled providers, including the priests, their wives, the people that have contact with patients. Of course, we have also been mandated. I lead the technical working group, and part of the 3 mandates is to ensure that there is supply chain for medicines and medical products, medical appliances and consumables. Instead of just buying from anywhere and anyhow, we can also have a concerted effort to ensure that the Church of Nigeria has access to quality assured medicines and medical products.
Speaking further, Professor Mrs. Babalola highlighted strategies the Church of Nigeria is looking to adopt to get and distribute quality medicine for better health care.
What we are trying to do too is to have a pool. We could have a pool of drug sourcing in different regions. Could be the 3 geopolitical zones or 6, so that there is a depot. And then we can source quality medicines from licensed providers, like companies that make these drugs, so that we can negotiate with them for discounted prices. And then we have a pool, and then have e-processing where people can always order, and then we send to them. At least that way we're sure that of the quality of medicines. We also could have, we are proposing that church should have built facility for contract manufacturing, or third-party manufacturing, where known companies can manufacture these simple medicines for Church of Nigeria. That will be the label for it. And of course, the longer goal is for us to have our own company that makes medicines and medical consumables.